Around 7 minutes, Ms Adamson.
Thank you very much, Presiding Officer. It's indeed a privilege to bring this debate to the Chamber this evening. I want to thank all colleagues who supported the motion and those who will be speaking this evening. I want to give my thanks to Food Train and its Eat Well, Age Well initiative, and for their tireless advocacy of rights-based policy making and better outcomes for older people in Scotland. Food Train was set up to help older people with access to food. The organisation has been developing its services for 25 years to help people eat well and age well. Food, company and feeling safe and cared for have been top priorities of the people who have used Food Train services. Through Food Train, service users have been given timely and invaluable insight into the issues we are discussing this evening. Indeed, further insight into the issue of malnutrition has never been more necessary. The impact of this issue on older people within our society is one which is frequently under-recognised. There are real concerns that the pandemic is compounding this problem, particularly in terms of isolation, which I will come on to cover later. 1 in 10 older people in Scotland are at risk of or living with food security issues. Approximately 103,000 older people over the age of 65 in Scotland are at risk of suffering from malnutrition. Research from projects like Eat Well, Age Well indicates that even those sobering figures may be underestimated. As many as 30% of older people could be at risk. This should give us pause for thought and determination for action. Tackling this problem requires understanding it and its many facets. Food Train have been championing the message of "Let's build the picture." This message is urging everyone working in community settings to uncover the true prevalence of malnutrition and the challenges facing older people in eating well. Malnutrition is largely preventable and treatable through screening and early intervention. And Eat Well, Age Well has produced a toolkit which includes clear tips and really simple tools to help identify the individuals that could be at risk from malnutrition. Most malnutrition occurs for people living at home. Yet, rates of malnutrition in the community for those living at home, older people in particular, are less well known in comparison to reported rates during, for instance, hospital admissions or care home and residential care settings. Building the picture, understanding the extent of the problem and recognising its causes is multifaceted and is essential that steps to ensure that we overcome malnutrition are taken. Last year, I was fortunate to attend the launch of the joint report from Eat Well, Age Well and the University of Glasgow, titled "Exploring Household Food Security and Malnutrition Risk with Psychosocial Indicators of Healthy Ageing in Place." The report highlights the financial barriers which are typically the focal point of research and policy into food insecurity. But for vulnerable older people in Scotland, food poverty and food insecurity are not the same thing. In Scotland and across the UK, there are stark inequalities in the ways people age and their experience of ageing. These inequalities, of course, manifest in deprivation and poverty. But when it comes to malnutrition in older people, policymakers must recognise this is only part of the picture. Older adults are at risk of malnutrition and an increased risk of lower well-being and social isolation and a perception of lack of control over their lives. The findings of the report revealed correlations between food insecurity and early indicators of malnutrition risk with poorer well-being and social connectedness. Researchers were clear that supported access to food is crucial in breaking that link. Those in receipt of Food Train services were more likely to say that services help them feel in control of their lives. It becomes clear that malnutrition is about much more than poverty. Food, eating it, preparing it, Sharing it is inextricably linked to the physical and well-being of all of us. Food is intrinsic to a person being in control of their lives and plays a key role in that feeling of social connectedness that is crucial for older people across Scotland. Building a sense of empowerment across our national policy and integrating into it community settings, it is therefore key to addressing these very complex, faceted issues. As outlined by Dr. Kate Reid, the report shows that inequalities experienced by older people are not simply attributed to financial barriers, but further through a diminished sense of social and cultural capital. This point is key because that concept is more nuanced than a lack of finance, and it can make these problems harder to detect. That is why we must embed these concepts into our policy making on malnutrition, and it is why raising awareness and investing in training, screening and the support around malnutrition is essential if we are to address this problem. And to emphasise, these are not COVID-19 problems. These challenges have been underlined and exacerbated by the pandemic, but we cannot view malnutrition in older people through a narrow lens. Our societies recovered from COVID must galvanise systemic and sustainable change. We know that Scotland is ageing. The over 75s are the fastest growing age group in Scotland, and the proportion of those aged 75 plus is expected to rise by 79% over the 25 years from 2016 to 2041. This is a present demographic challenge, but it delivers a unifying objective for policymakers and legislators. We must build a fairer Scotland for older people. We must ensure that challenges faced by older people, such as food insecurity, loneliness, access to health and social care, are met with a compassionate and rights-based governance. The Scottish Government has consistently shown its commitment to advancing the human rights agenda. It has set up a national task force on human rights and remains committed to incorporating the United Nations Convention on the Rights of the Child into domestic law. To meet the challenges of an ageing population, the Scottish Government strategy, A Fairer Scotland for Older People, a Framework for Action, outlines priority actions to tackle the barriers to a positive older age identified by the Older People's Strategic Action Forum. Malnutrition has been specifically identified as a key issue affecting older people, and a national commitment was made to tackle malnutrition in a fairer Scotland for older people. However, too many older people in Scotland are at risk, and there remains a dearth of public awareness around this problem. Malnutrition regularly goes undetected, untreated, unrecorded, and it can be overshadowed by public health messages focusing on other diet-related issues. We must better understand the problem and continue to gather essential primary data through research. We have to recognise at policy level the nuanced difference between food insecurity and food poverty. We must invest in training in malnutrition for health and social care professionals to improve confidence and knowledge in screening and providing support. And we must support community initiatives that address social isolation, given that this is a key factor in malnutrition. By investing in long-term systemic change, we can empower older people to feel in control of their lives, and we can support older people to eat well and live well. We can build a fairer Scotland for older people, founded on the principles of dignity, respect and compassion. Thank you, Presiding Officer.